afternoon, class. To formally start our discussion, I'm requesting everyone to please stand up and let's first glorify and thank our Almighty God. In the Father, the Son, and the Holy Spirit. Amen. Amen. Please be seated. Let us check your attendance first. Who is absent today? None? Very good. Let's clap our hands. Who can remember our previous lesson? Anyone? That's right. Our previous lesson is about personal health goal. Everyone, let's have a short activity just to warm up ourselves. This activity is called 4 pigs, 1 word. I will show you pictures and all you have to do is guess it. The one who can guess it first will gain 10 points. What is in the first picture? Very good. It is community. What is in the second picture? You guess it right. It is a medical field. And how about the last one? Perfect. It is what we call health. I will group you into 2 groups. This is the group 1 and this is the group 2. In a clean sheet of paper, write it down. What do you think is our lesson for this day all about? Based on the activity we just did, I will give you only 2 minutes to prepare. After that, pick 1 person from your group that will read your answer in front of the class.
Good afternoon, class. I am your second instructor. My name is Enrique Dino 23rd, but you can call me Teacher Enrique. Okay, class, I want you to read our lesson objectives. Very good. So that is our objectives. And now, what comes in your mind when you heard the word community health? Yes, very good. Community health is a branch of public health which focuses on people and their role as determinants. It means community health refers to simple health services that are delivered by laymen outside hospitals and clinics. Community health is also the subset of public health that is taught to and practiced by clinicians. For example, the people of the community of Barangay Kalumpa. Me as a nurse, there we deliver different health services like medical and dental checkups, vaccinations, and so on the people who are in the community of the Barangay Kalumpa only. And that is the meaning of community health. I hope that you understand this topic. Thank you.
Good day everyone, I am Jameline M. Himilo and I am here to discuss about measuring community health. Community health is generally measured by geographical information system and demographic data. Geographical information system can be used to define sub-communities when neighborhood location data is not enough. Community health has been measured using sampling data which then compared to well-known data sets like the National Health Interview Survey or National Health and Nutrition Examination Survey. With technological development, information system could store more data for small-scale communities, cities, and towns, as opposed to census data that only generalize information system about small population based on the overall population. The ease of use of Geographic Information System or GIS advances the multi-level statistic and spatial analysis method.
Hello, I am Angelo Gastador Arioquinto, 20-year-old third-year BPED student of John Santos Foundation College Incorporated. My task is to discuss the number 1 category of community health, which is the primary healthcare and primary prevention. So first is, what is primary healthcare and primary prevention? So, listen. Primary healthcare and primary prevention, the programs aims to reduce risk factors and increase health promotions and prevention. Primary healthcare is provided by health professionals, specifically the ones a patient sees first that may refer them to secondary or tertiary. So, for more information, this is my explanation about this topic. Primary healthcare or PHC refers to essential healthcare that is based scientifically sound and socially acceptable methods and technology. This makes universal healthcare accessible to all individuals and families in a community. Primary prevention aims to prevent disease or injury before it ever occurs. This is done by preventing exposure to hazard that cause disease or injury, altering unhealthy or unsafe behaviors that can lead to disease or injury, and increasing resistance to disease or injury should exposure occur. I hope you learn and understand my topic. Thank you.
Good day everyone, I'm Cheska P. Coloman and I'm discussing the secondary healthcare and secondary prevention. Secondary prevention refers to improvements made in a patient's lifestyle or environment after the onset of disease or disability. This sort of prevention works to make life easier for the patient since it's too late to prevent them from their current disease or disability. Community health can also be improved with improvements in individuals' environment. In developing a health improvement program, every community will have to consider its own particular circumstances, including factors such as health concern, resources and capacities, social and political perspectives, and competing needs. Community health status is determined by the environmental characteristics, behavioral characteristics, social cohesion in the environment of that community. Appropriate modifications in the environment can help to prevent unhealthy behaviors and negative health outcomes.
Hello guys, yes, first of all, I'm gonna introduce myself first. I am Janime Llorente, and for today's class, we were gonna talk about the tertiary healthcare, the third type of the healthcare in the community. Okay, what is tertiary healthcare? Tertiary healthcare refers to this highly specialized care, usually involving disease or disability management. Okay, it says there that this type of management should given in the community that has involved people who are diagnosed in any complicable diseases or community that has involved more disabled persons. Okay, so it's because tertiary healthcare was managed by the highly professional medical specialists, because the given care of in this management was the highly specialized care also. Okay, so what is the prevention of this, or what is the prevention program of tertiary healthcare? So it says here that the tertiary healthcare prevention involves the prevention of complication in people who have already developed disease and whom disease prevention is no longer an option. It's because for these patients, the goal of tertiary prevention is to maximize the outcomes and prevent further suffering or morbidity from the disease process.
Good day everyone, I am Divine Grace Mariano and I am here to discuss the generalization or the synthesis of the community health. Community health covers a wide range of healthcare interventions, including health promotion, disease prevention, and treatment. It also involves management and administration of care. Community health workers, or the CHWs, are often frontline health professionals with knowledge of specific characteristics and developments of the community. They are often members of the community themselves and play an important role in the functioning of community care. Community health is a medical practice which focuses on people's well-being in a particular geographical area. This essential public health sector covers programs to help neighborhood members in protecting and improving their health, deter the transmission and infectious of diseases. The World Health Organization defines community health as the environmental, social, and economic resources to sustain emotional and physical well-being among people in ways that advance their aspirations and satisfy their needs in their unique environment. It is a branch of public health that focuses on people and their role as determinants of their own and the other people's health. This is in contrast to environmental health, which focuses on the physical environment and its impact on people's health. It is a major field of study within the medical and clinical sciences that focuses on the maintenance, protection, and improvement of the health status of population groups and communities. The health of a community is dependent not only upon the genetics of its residents, but also upon the environment within which those individuals live. A person's health is a product of their environment. As such, a healthy community is one in which all residents have access to a quality education, safe and healthy homes, adequate employment, transportation, physical activity, and nutrition. In addition to quality healthcare, unhealthy communities lead to chronic diseases, such as cancers, diabetes, and heart diseases. A healthy community benefits every person in it, and community health is one means of achieving a healthy community. The field of public health aims to protect and improve health by addressing the structures and systems that define a place and by supporting the people who live and work there and making healthy choices. Problems are studied, data is collected, and resources are gathered to help solve those problems.
Do you have any further clarification or questions about our discussion, class? None? Okay, I think you guys clearly understand our discussion. So let's have an activity. Same as your groups earlier, create a comical skit on how to promote a healthy community and present it in front of our class. And this is your criteria. You only have 25 minutes to prepare, so go to your respective group, then start. First, I would like to congratulate everyone for your amazing presentation. It really shows that you listen and understand our discussion. Let's give a clap for ourselves, everyone. For your assignment, kindly take note, this will be passed on our next meeting. Thank you and goodbye, everyone. See you on our next meeting.